in order to promote partnership between public and private sector, and in order for Africa to have a healthier continent which has a youthful, productive workforce, we have decided to move ahead to form a unified singular platform under Africa Healthcare Federation. This federation will bring 5 regions in Africa to work together with the ministries of health in improving policy and regulations throughout the continent. Each country in Africa will have a champion from the private sector, and in each country in Africa will have a champion from the Ministry of Health, because of people living in remote areas and distant facilities. Many mothers and children are unable to access healthcare in a timely manner. You know that some of the counties in our country have been rated to have the world's worst maternal mortality rate. I want them to walk the journey with us for creating an enabling environment. That's all we're asking. If they create an enabling environment and have the right laws, private sector is like water. It will look for opportunities, it will find ways, and will create solutions to problems that exist. The other thing we're asking the government to really consider is the non-social determinants of health. You know that lack of water, clean water, is responsible for a lot of disease burden. Pollution is responsible. Nutrition, education, lack of infrastructure, building appropriate roads, making and ensuring that we have power in areas where there is no electricity. All these are non-social determinants of healthcare, which we believe prevention is better than cure. These are the determinants that keep patients out of hospital. We don't want to see diarrheal diseases. We don't want to see skin diseases, because if the Ministry of Water provided them with good water, hygiene, nutrition, we'll be keeping many patients out. So again, we want to partner with the government in ensuring they continue focusing on public health, on preventive, and we can focus on many other aspects like curative, non-communicable diseases and other challenges. But it will be a symposium that will draw a matrix for implementing the core activities assigned to every country. And this will be monitored by regional heads such as WAHO. You'll be pleased to know that the WAHO head, Zuma Salifu, is traveling from Ouagadougou for this event. We should have movement of health workers within Africa that travels seamlessly. We should have a medical health plan that should be borderless and allow portability of any African citizen to carry the health card with them from country to country, from region to region. We should have goods, medical equipment, drugs, and all those commodities that are required to be brought into the African countries without penalizing them and double taxing or triple taxing. Does it make sense if you bring Brufen 400 milligrams into Rwanda and you have to pay $5,000 for registration, and you pay the same $5,000 in Tanzania and in Kenya and in most countries? These multiple fees are reasons why healthcare is expensive. This cost is eventually transferred to the patient. Through a harmonized, coordinated regulatory mechanism, we should be able to bring the costs of healthcare down. We should be able to have nurses moving from country to country. We should not be charging permits of 400,000 shillings for a nurse that may come into Kenya to work in our health industry.
Is to improve lives of 3 billion people annually by the year 2025. To improve lives, we really have to make sure that we make an impact in parts of the world which really need it. And Africa is that continent which really needs an impact, which is not doing regular business. And it's regular business of selling equipment, but making sure that we create partnerships which are meaningful.